It's my lunch break, so I'm going to start this video. This is my week in the life of a GP. So if you don't know me, I'm Lauren-Jane, I'm the surgical doctor. I'm a foundation trainee and I'm in my GP rotation. So as a foundation trainee, obviously I am a qualified doctor, but I'm not a GP. So I am running my own clinic. I have my own list, I've got my own room, but I would have slightly longer than the other GPs because they're much more experienced, much quicker than I am. And there's all kinds of things that we see. There's a lot of variety in GP, so I'm going to be going through what my week looks like, and then at the end we'll talk about things like GP hours, how much they earn, and what the training pathway is, and we'll talk about the pros and cons. So I started just before 9 this morning, got in. It's one of the nice things about GP. This surgery is not too far from my house, which is great. It's had a nice commute. It's always the same faces, which is really nice. That's something you don't find in the hospital. And we're obviously in COVID times, so we have an electronic system where patients can call or text in to the system, and then their query gets sent over to one of the GPs, and these pop up in my system as a request. What I would do is go through and I would see if anyone needs urgently speaking to. If someone has something that I need a picture of, I'd send them a little text and say, you know, can you send me a picture of the toe or the foot or the rash or whatever it is. And we can either do a video consultation, a phone consultation, or if I'm concerned about something, I might bring them in for a face-to-face consult. Just seeing all kinds of things, so different, you know, there's always, it's GP, so there's all kinds of different things, like someone might have a swollen eye or a chest complaint, someone might be really poorly. We are seeing less kind of like chest infections and things like that because anyone who's got any COVID symptoms is being seen in specialist COVID centres. So I'm not really seeing people with coughs or fevers, which is usually kind of a staple of GP. So this does make that I found that GP does look a bit different. Hello, so oh God, look at my hair. It's going to see what day in GP is like. So I have just finished day 1 in GP. I'm finishing over an hour and a half late again. It's a bit of Monday syndrome, but I do find it quite difficult, to be honest, because obviously just had a baby, and you know, I want to get home to my baby. I don't want to stay late every day after work. But this is part of being a doctor. Although I never usually, I'll say this, I never usually stay late in the hospital. I almost always leave on time. Good morning everyone, it's the start of day 2 in GP. I've got patients to see and letters to do, so I'm going to crack on with it. Hello everyone, so that is the end of day 2 in GP. So I had a much better day today actually. I had around 9 patients booked in with me, and they had varying different things. There's a lot of breadth in GP, so I saw some things that were to do with the breast, seen sort of sinusitis, lots of different things. I had a lady who I was concerned might be having a stroke, and actually that was really odd in the time of COVID because you actually can't see the patient, and as doctors we learn so much about how well a patient is by seeing them. So you're talking to them on the phone and you're trying to work out how poorly they are. So all in all, I had to, you know, work out what do I do, because ultimately hospital isn't a safe haven at the moment, especially for patients who are at risk of COVID. So I had to decide whether to send her in as a stroke or whether to keep her in the community. I did discuss it with a senior GP because ultimately we are foundation doctors and we shouldn't be making these decisions on our own. So we are supported here in GP. In the end, I did send the patient to the hospital, and I hope she's fine. A lot of my day has been using the online service where patients are now referring themselves in via the computer or text message, and then I ring them or bring them in if I think I need to see them, or see them via video consult. And that works very effectively. I have brought patients in today because I felt like I needed to do an examination on them. Other things that I've seen have been things like Raynaud's. So Raynaud's is very interesting. If you don't know what Raynaud's is, it's a condition where you can get your fingers, when they're exposed to cold or stress, go very white and they feel cold, and then they can kind of go purple. What's interesting is that certain patients who develop it later in life might have a secondary syndrome, something that's causing the Raynaud's. That can be something like lupus, so sometimes you would have to potentially investigate that. So it's been quite an interesting day, and I'm actually about to leave, and I'm about to leave on time. Oh, I haven't done all my clinic letters as well. I've managed to get all my clinic letters done. So clinic letters are letters that come from the hospital, say if the patient's been seen by respiratory or if they've been seen by rheumatology, they would then write to they would then write to us and say, you know, either no, this is what we've done, no action for you, or please can you change the medication, please can you arrange bloods in 4 weeks. And actually, as in GP, there are hundreds of these coming through the surgery a day, and it takes quite a lot of time to sit and go through them. And mine have been backing up actually for the last couple of days, but I've actually managed to complete them all, and it is only 20 to 6, so I'm only 40 minutes late from work today. So I'm going to stop video recording and I'm going to go home. Bye. Good morning. It's the start of day 3. I'm here a little bit early just to have a look at what I've got to do. I'm ready and raring to go. I've got a couple of patients booked in and we'll see what the day holds. Hello, it's day 3. I had a good day, or should I say half a day, because the way it works when you're a junior doctor is you get some teaching every other week. Sorry, I'm out of breath. I've just run up the stairs and I've got a bit of a cold. So I had a good day. Started at 9. And then obviously got teaching this afternoon, so I've only done a half day. I love those days. But I had a great morning. I didn't feel like I had way too many patients, which is what I've been feeling. So one of the struggles with GP for me so far is just feeling like there's so much to get through. I'm feeling pressure to get through it. And I don't know whether I'm having less patients or I'm getting slightly more competent and I can get through them quicker. Because it's like learning the systems as well. So the type of patients that I've seen this morning, I sent someone for an endoscopy, a tube down the throat. So sometimes when people present with indigestion, that's fine because most of us get indigestion and we treat it over the counter with like Gaviscon or Remy. But what we always want to do is rule out that it's not something more serious. So do they have signs and symptoms that might make us think it's more serious, like weight loss or problems swallowing? They might have some, you know, systemic features, change in bowel habit, those kind of things. So I always try and rule out those sort of things, and I ended up sending a chap to have a camera down the throat. What have I also done? I've seen a child who had hand, foot and mouth disease. I do worry about seeing children because I haven't had a lot of experience of that in the hospital, but I always just try and work out, are they systemically well? So if mum says that they're playing, they're eating and drinking, opening their bowels, going for wheeze, generally that child is hopefully fairly stable and fairly well. And if mum as well, if mum has no concerns, that's reassuring. So I've seen that. The treatment for that is supportive. So just looking after them, giving them fluids, and then trying to stop the spread of contamination by not sharing blankets or towels, things like that. I've seen a couple of patients with water infections, UTI, treated them with antibiotics, and I've given someone a sick note, or we call it a fit note now, so I've done that. So generally a good day. It's been a good day. So it's day 4. I've started off the day by seeing face-to-face a patient who is very teary, very sad. This is very common to see people who, because obviously, you know, COVID, everyone's isolated. We're all isolated from our coping mechanisms. Things at work have changed. It's all very uncertain. People are cut off from families. So I'm seeing a lot of patients who are down and not coping, or feeling like they're not coping. So some of the things that we would do is refer them for talking therapy, like Let's Talk Wellbeing. Might start them on medication if they need that. There is as much evidence for talking therapies as there are for certain antidepressives. So I always like to tell my patients that as part of the counselling process. So as a doctor, we don't just diagnose and say this is the treatment. We discuss it with the patient, and then if they agree to take a treatment, then we would do what we call counselling, which is where you would tell them about the intervention, the medicine or the treatment, and then really give them a chance to think about whether they want it. Also, signing patients off work is something that I find is really helpful for patients, because a lot of, you know, if people are really work tends to be people's, you know, most intense stressor a lot of the time, other than finances. So being able to sign someone off sometimes just really gives them that relief and that space that they need to allow the medications to work or the CBT to take. So I had a nice conversation this morning. Day 4 is busy, so I'm just about to take my lunch break now, which is why I'm making the video. But yeah, I need to crack on. Other things that I've seen tend to be, it's always just, it's different every single day. So someone might have a lump somewhere, they might have symptoms of thyroid disease or infertility. I quite like dealing with infertility. Obviously you get women who are trying to have babies and can't. So we need to take a full history, do bloods. Good fun. Hello, it's the end of day 4. I actually managed to leave about 5:20, so I'm rotated to work 9 till 5. Managed to get out 5:15, which is absolutely excellent going. The sort of patients that I've seen today are, so I have seen patients with depression. I think I mentioned that earlier. I've seen patients with tummy upsets and patients with indigestion. That seems to be a common one. People with kind of a feeling of something stuck here that really bothers them at night. Lots of people that have got vague kind of symptoms of dizziness or tiredness. And actually in GP, I find those sort of complaints the most difficult to deal with as a junior doctor, because when someone's got kind of a vague complaint like tiredness or something like dizziness where you can't work out, you know, if it's in the ear, it's fairly easy to treat, but I find that quite difficult to deal with because it could be so many different things. And I think that's one of the challenges of GP. And the other thing that I find really challenging is that no one has ever just got one problem. So you have, you know, you get 10-minute slot for most GPs, but for me it should be about half an hour. And I need that half an hour for one problem, really, for having the chat, doing the examination if there's one, doing the investigations, the diagnosis and counselling the patient. But actually, if people have got 3 different problems, oh, you know, I've got tinnitus in one ear, I feel really dizzy all the time, and also I've got this thing on my foot, actually that ends up taking a lot longer than half an hour. And sometimes I find that I can spend up to an hour with a patient. And see, I have the patients that are booked in to see me, but then also I have clinic letters to do, and often they involve ringing a patient and having a conversation with a patient, which can take time as well. So this is one of the things that I'm struggling with in GP, is just trying to get everything done in my allotted time. But one of the things that made me really happy today was that a patient said that I brought her in because I felt like she needed a consult, and she said she wanted to hug me. And that made me feel nice, because in GP there is, I think, the opportunity to be able to chat to people and really make a difference, and I feel like I did that today. Morning, day 5. I'm rushing in, got wet hair, but I'm feeling a bit more confident. So I'm obviously doing these day by day, but I'm now a couple of weeks into my placement, excited to see what the day holds. Hello, end of day 5. So a good day today. I'm finishing and it's light. I've seen a range of patients. What's really interesting actually is as a med student, we would see loads of coughs and colds. And obviously all of those patients are not coming to us because they're going to places where they've got a specialist PPE. So the things that we tend to see are, you know, foot infections or problems with blood pressure, abdominal pain. I had a patient who I'd like to have seen who had a surgical site infection but had some systemic features, so needed to go and be seen where they have PPE. But overall, a really good day. To finish off then, here's the GP training pathway. So as you can see, so foundation training is what you start straight from medical school. So after medical school, you would start your foundation program. You would do F1 and F2. You may well do a GP job as either an F1 or an F2, usually it's an F2. You don't need to have done one in order to apply to be a GP. After F2, you would apply to be a GP, and then you would do your GP training, which takes 3 years. What this would involve is basically just what you've done in F1 and F2, which is rotating through different jobs in the hospital. And these are usually jobs that are highly helpful for being a GP. So things like obs and gynae, trauma and orthopedics, pediatrics, ENT, those kind of things. You do that for 2 years, and then in your GP year 3, you spend a year in GP, just kind of refining your GP skills. After that, you're awarded your CCT, which stands for Core Completion of Training, and you can start work as a GP. At that point, you can go and be a partner straight from graduating from being a GPS 3, or you can work as a salaried GP. I've got the salaries on the next page. They are quite broad. In terms of being a GP partner, there are more skills involved here than just being a GP, because it's running a business as well as working as a GP. It's not something I've got experience of, so I'm not going to go into too much detail, but effectively you can earn a lot more money as a partner But like I said, you're effectively doing two jobs. So you are working as a GP, but then you are also running the practice and that's part of your role. Otherwise, you can be a salaried GP. That basically just means you're working full-time as a GP in someone else's practice for other partners. Or, I suppose, option number 3 is that you can locum, and I know quite a few GPs who do locums. Most of them do work in multiple practices. One of the great things about GP is there's quite a lot you can do with it. So the week is broken down into sessions. So a morning or an afternoon is a session, so 2 sessions a day. Most people don't do 10 sessions anymore. So you could do 8 sessions and do a day of teaching. You could be less than full time and just do 6 sessions a week. Or you can do as many sessions as you like. GP sits in very well with... So GP is very useful if you're interested in surgery. You can run minor ops lists as a GP. So you could do perhaps 6 sessions in GP, and then you could do a full day doing things like vasectomies, or you can remove, I think, lots of dermatology lesions, things like that. With GP, you can really make it what you want. A lot of GPs have special interests. So you might be a person who's a GP partner who has an interest in research or teaching, or your special interest might be something like gynecology, and you would see a lot of the gynecology patients, or paediatrics or something like that. Okay, so here are the salaries. So usually for a salaried GP, so this is not a partner, your pay scale usually starts at around 60,000, but it can go up to about 91,000. And like it says here, that will reflect your level of experience and qualifications. So that's everything. So thank you so much for watching the video. If you have any questions or comments, you can leave them beneath. Please like and subscribe if you enjoyed the video, and you can find me on Instagram as a surgical doctor. Thank you. Bye.